Hello,
Hello,
how are you?
ready to talk.
Ready to talk? All right, good. I'm ready to laugh. Um, so I'm Dr. Tanno. Today we're here with Dr. Berger. Dr. Berger, how long have you been with the practice?
28 plus years.
Oh my God, 28 years. Okay. And so Dr. Berger is going to talk about, hopefully, a funny talk on humor in medicine. But let's give people another minute or two to get started. It looks like we have a lot of people joining, even over every few seconds. But just as a reminder for next week, Monday is Memorial Day, even though this is probably the least, not that Memorial Day is ever celebratory, but the least celebratory Memorial Day out there. But as a result of that, we do not have any lectures on Monday. Our office is closed. Wednesday is Dr. Karya Holmes, who's one of our new doctors. She's been on a few webinars. She's going to do a talk on, it's called Coffee with Karya. She has a great personality, so I thought she should just have her own radio show. So she's going to do a webinar, and it's going to have a focus on questions about alcohol. So she's going to talk about how many is too many, and she's going to reveal her favorite cocktail. So that should be interesting. And then on next Friday, Dr. McConnon, who's our sleep doctor, who gave a talk on insomnia, is going to give another talk on Dr. Berger, hear me? No.
You hear me?
I got it. Okay.
Okay.
All right. Could you hear me while I was talking?
Yes, I could.
Okay. So sorry. So next Friday is going to be Dr. McConnon talking about sleep apnea. So it looks like we have a little bit of a sketchy internet connection here. Either it's on my end or Dr. Berger's end. So I don't know what the story there is, but if people are, if we're having technical issues, I apologize in advance. We are not great with our IT work here, but let's go ahead, and it looks like we have about 110 people on the call, so we'll go ahead and get started with Dr. Berger.
So my talk is on humor in medicine and the importance of laughter. This talk has actually been given in another form over 30 years ago. 30 years ago, a little over 30 years ago, when I was a medical resident in Philadelphia, I was leading a team that had a second-year resident, a first-year resident, a couple interns, and a couple students. And we would meet for rounds every morning. Usually at 7 a.m., they would have already seen the patients, and we'd review and go over everyone. And I had a rule that whoever was the last one to come to round had to tell a joke. It did not have to be a clean joke, but it had to be a joke. And one, it served to allow everyone to tended to come on time. And two, a lot of the other teams came over to hear our jokes of the day. And it was a good way, because it was very stressful sometimes dealing with sick patients. It was a way of relieving the stress. As a third-year medical resident, all the residents were required, when they were in the university hospital, to give a grand rounds talk. At the end of the year, there was an honor given to two of the residents every year to give a second grand rounds talk on whatever they liked. And I gave a talk. I was one of the people picked, and I gave a talk on the influence of humor in hospital workers deal with the stuff they go through on a regular basis. And the only thing I'm going to use from that talk 30 years ago is the first paragraph. In the center of the room was a stretcher. In the center of the stretcher was Annie O. She lay motionless, her knees bent up towards the ceiling, her shoulders curved around towards her knees, so that her head, unsupported and rigid, almost touched her thighs. From the side, she looked like the letter W. Was she dead? I called to her. No answer. I felt for a pulse. No pulse. Heartbeat, none. Breath, no. She was dead. I felt relieved she was dead, that the pressure to care for her was off. I saw her little tuft of white hair, and I remembered my grandmother lying in her coffin, and I was filled with sadness for that loss. She's dead, I told the fat man, my resident, but he just thought I lost my mind. Fat said, Annie Ohm is a true Gomer, and one number one is Gomer. But she's dead, I said. Just look at her. She looks dead. I called her for a pulse and listened for her heartbeat, for her breath. Nothing. That's replied, with Annie, you need the reverse stethoscope technique. Watch. The fat man took off his stethoscope, plugged the earpiece into Annie O's ears, and then used the bell like a megaphone, shouted into it, Cochlea, come in. Cochlea, come in. Do you read me? Cochlea. Suddenly, the room exploded. Annie O was rocketing up and down the stretcher, shrieking at great pitch and intensity. Roodle, roodle, roodle. Then Fats looked at me and said, repeat after me. Gomers do not die. This excerpt is from The House of God from 1978 and was sort of a book that sort of, if you read it as a medical student before you started your clinical rotations, you wouldn't believe any of it is true. The later on you went on your education, the more you believed it was true. Medicine has a form of gallows humor, which is described as a morbid humor that people use in the face of tragedy or it's based on Freud's theory that joking relieves anxiety or repressed impulses and that laughter converts unpleasant feelings into pleasant ones. The use of gallows humor in medical settings raises an important point, that all humor exists within a certain culture or subculture. But as a result, what may be funny to one group may not be appreciated by others or in different settings. One study found that experienced paramedics do not share their work-related humor with family and medics, for fear it will be misunderstood. As part of my talk 30 years ago, there was an index that rated how difficult a patient was going to be. And I'd like to just read a couple of the entries that are appropriate for the non-medical people. Admitting note from the outpatient division ends with sorry. Patient is unemployed because of a service-connected wound from World War I, Spanish-American War, or Civil War. Patient bites bulb off of oral thermometer. Patient bites bulb off of rectal thermometer, or even worse, patient bites bulb off of other patient's rectal thermometer. And patient with flatline EKG, family thinks patient is improved. Now, this is clearly gallows humor, but it is commonly used in the medical field to help deal with it. Now, in 1979, the New England Journal published a landmark report from Norman Cousins, who was at that point a noted journalist and editor of the Saturday Review. In the 1960s, Cousin had a severe form of ankylosing spondylitis, which is a debilitating spinal disease which caused severe and incapacitating pain. Cousins was not getting better with the hospital treatment. Cousins was not getting better with the, can you please leave? Sorry, my wife is bothering me.
I'm not your mother.
I know, but I can't talk and you're distracting. Sorry. Cousins checked himself out of the hospital because he was not getting better with conventional humor. He decided he would check himself into a hotel. He would watch continual episodes of Candid Camera and the Marx Brothers and take large doses of vitamin C. He found over time that laughter stimulated chemicals in his body that allowed him several hours of pain-free sleep. He continued this treatment until eventually his disease went into remission. He published the best-selling book, Anatomy of an Illness, as well as there was a television movie based on this premise. Since Cousins' groundbreaking study, there have been many similar replicated reports. The University of Maryland did a study where they showed that laughter improved cardiac health. The results, which were presented at the American College of Cardiology, showed that laughter had a physiologic effect of increasing blood flow and avoiding vessel constriction and reducing cardiac events. Now, there are other studies that show that humor can moderate response to pain. There have been experimental studies in which a patient's pain tolerance is evaluated before and after exposure to comedy videotapes. In most cases, the ability to tolerate pain is enhanced after exposure to humorous movies. There's also other research in which a patient's need for pain medicine has been studied after viewing comedies. In a well-controlled study, patients were showed humorous movies right before and right after orthopedic surgery. There was noted no change in need for pain medicine on the first postoperative day, but the experimental group that was shown the humorous movies had a 61% decrease in need for minor pain medicine, Tylenol, aspirin, anti-inflammatories on the second day after surgery. The interesting variable was patients who did not have a say in which funny movie they were given had no improvement in their pain control. Some hospitals are aware of this, and there are hospitals that have formal humor programs. They bring clowns in, they bring comedians in to tell jokes in the wards. They have humor carts. These are carts that volunteers bring around to patients, which have everything from humorous books, videotapes, comedy movies, and comics. There was an observational study in which patients used humor to reduce anxiety and frustration, and it was noted that patients that seemed to have more sense of humor had a better hospital course. Laughter stops fear. It's hard to be afraid when you're laughing. Laughter helps you relax. There's studies that show that laughter improves endorphins and enkephalins, which reduce depression and make you relax. Laughter can be cathartic, it can ease pain, it can combat stress, and it tends to be contagious. If someone around you is laughing, it's hard to be in a bad mood. Laughter has physiologic effects. It increases your intake of oxygen-rich air, stimulates your heart, lungs, and muscles, and increases the endorphins that are released by your brain. It reduces your stress response. It improves. There's studies that show it can boost your immunity. It relieves pain, increases personal satisfaction, and improves your mood. Studies show that a good hearty laugh can reduce physical tension and stress, leaving your muscles relaxed for up to 45 minutes. Laughter can also burn calories. It may not be a replacement for exercise, but there was a study that showed that if you laugh for 10 to 15 minutes a day, you can burn approximately 40 calories. And the 40 calories that you burn is enough per day is enough to lose 3 to 4 pounds over the course of the year. There's also some studies in Norway that have shown that people who are judged to have a stronger sense of humor outlive those that don't, especially when dealing with cancer. Laughter tends to be contagious. There's many reasons why TV sitcoms use laugh tracks. You're more likely to laugh when people around you are laughing, and the more laughing you have, the more happy you are, and the more you enjoy it.
Should I turn my sound on then?
You can.
So I can be your laugh track?
Smiling is also important. If you ever notice, if you go up to people and you smile, they tend to smile back and both people are happy. You don't get that. Now, there's certain things you can do to create opportunities to laugh. You can watch a funny movie or TV show or YouTube video. You can go to a comedy club when there's not a pandemic. You can read the comics or spend time with people you consider funny. You can host game nights with people. There are, believe it or not, yoga classes that are laughter yoga classes. Now, approximately 25 years ago, I started my Black Book. This is actually the first time I'm ever sharing it with patients. My Black Book contains no names, no identifying marks of any patients. It's just something that I decided should be written down because I wanted to, one, remember it, and two, I'm not sure if anyone would believe it if I didn't write it down. The episode that caused me to start the Black Book was a young gentleman who came to my office because his girlfriend, quote, had something, and she sent him to being checked out. He had a completely normal exam, including a genital exam. I called his girlfriend, and after a few confusing minutes, I was able to figure out that she was treated for a vaginal yeast infection. I informed her it was not a sexually transmitted disease and her boyfriend's exam was completely normal. She asked me if I can do a more thorough exam. I asked her what she had in mind. She asked if I can do a pelvic exam and a pap smear on our boyfriend. I informed her that normally you need a cervix and a uterus to do this. She then, honest to goodness, said, could I make an exception this one time? And that started my black book. I would like to read some of the entries from my black book. All of these are true. One of my partner's patients called to ask if she should stop her glucosamine chondroitin. As she read in the Washington Post, it may predispose to diabetes. I told her I had not seen that article and was not familiar with this association at all. She said she read it in the veterinarian's column. When I looked at it, the vet stated that glucosamine chondroitin might not be good for dogs. I advised the patients to stop following the vet's advice for her. I was asked by a patient a simple question about her cholesterol medication. When I called her, she was not in, but her husband was there. I asked for the patient, and he said, I'm sorry, she's not available. She's on Mission Impossible. I answered the question she asked, and I obviously asked, what's Mission Impossible? He stated she was at the beauty parlor. I had an 89-year-old patient who had developed severe diarrhea. And he decided the best way to deal with severe diarrhea is to take large doses of milk of magnesia to flush the diarrhea out of himself. He became incontinent of a large amount of stool, and he then called Adult Protective Services on himself because he was concerned he was a danger to himself. They called me about it, and fortunately, he didn't do that again. I was asked once for a note to excuse a patient from jury duty. I told the patient she had no medical conditions which qualified her to be disqualified from jury duty. I said, what's her reason she didn't think she should be on jury duty? Her exact quote was, I think I'm too stupid to serve on jury duty. I told her I could not give her the note and I would let the judges and the attorney decide for themselves. I had a patient who was a 62-year-old male who I hadn't seen for a year and a half. He called asking for a muscle relaxant because he hurt his back. When I asked who had been checking his cholesterol because he was on Lipitor and had not been checked since I had last seen him in a year and a half, he paused briefly and said, God. I advised him to ask God for the muscle relaxer. I told him if God was unwilling to please make an appointment to see me. He did make an appointment. I had a patient who lived near the woods and presented with a classic Lyme disease rash. And I asked him how he got it. And he said he had picked a tick off of his dog about a week ago. And he had wanted to take a good look at the dog to see if he could figure out if it was a Lyme disease carrying tick or not. He put it on the back of his wrist and took a magnifying glass to it and looked at it very carefully. He then presented 5 days later with the Lyme rash on the back of his wrist where he put the tick. One of my senior partners, who shall name nameless, once called me on a weekend to say he was having trouble getting into he needed to get into the office after hours, and he was having trouble punching in the security code for the burglar alarm. I gave him the code and instructed him what to do. He calls me back 5 minutes later and says he's punching in the code, but the alarm is still going on. I asked him to show me with his phone what he was doing, and it turns out he was punching in the burglar alarm code to the time clock. I had gotten a call from a panicked nurse. A patient with severe Alzheimer's wandered into another patient's room and ate an entire can of cat food. I informed the nurse that she was in no medical danger, that it might have tasted better than the regular nursing home food, and basically to check her for hairballs and give her a good brushing. I had a patient of mine who was getting an EKG done by one of my nurses who was extremely quick and speedy, and he asked her if she was KGB, and she said no, EKG. I had a patient report that his wife, as a surprise present to him, was in a silent auction for charity and won a free stress test, and the patient asked me what he should do about it. And I said, be thankful that he didn't win something donated by a urologist. I had a patient of one of my partners was asked on a questionnaire before their visit, what is the hardest thing for you to do? And it was meant in terms of daily activities. And the patient wrote, pay my mortgage. I had a patient with severe emphysema on oxygen call to tell me that she had a cold and had not been feeling well and was a little more short of breath than normal. I asked her to come in so I can examine her. She said she didn't feel well enough to come in and will come in when she feels better. I had a patient tell me that veterinarians are far more advanced than medical doctors in diagnosing Lyme. A patient asked for a C6 Lyme test, and I told him I had never heard of it. I looked it up, and it was for a form of canine Lyme. I told the patient unless he starts barking, I would not order it for him. I asked a retired fisherman, it was his full-time occupation, what was the biggest fish he ever caught? He nodded over to his wife and said, her. I asked a 98-year-old woman how she was doing at the beginning of the visit, and she replied, I take my pulse every day, and if it's there, I get up and get out of bed. When asked an 85-year-old with a history of a stroke, how is he doing? He said, nothing hurts, but nothing works. I had a patient present with second-degree burns when they decided to steam their shirt while still wearing it. Informed the patient it was not the best idea. An 87-year-old with a history of a stroke 3 years before suddenly developed slurred speech and tingling of the lips. Instead of going to the ER as his wife insisted, he drove 52 miles each way to pick up 125 lobsters for a church lobster fest. When he delivered the lobsters, he was met by a nurse practitioner who immediately realized he was having a stroke, called 911, and forced him to go to the hospital where he was admitted. One of the more unusual reasons I had a patient go to the emergency room, I had a 49-year-old female who hyperextended her finger trying to take off her skinny jeans. I had a patient of my partner's who presented with a brown stain under his foot. He tried washing it off with soap and water, but it didn't come off. As any good patient will do, he did an extensive Google search, and he realized and came to the conclusion that he must have liver disease because liver disease can cause brown spots. He came to my partner to see him. My partner promptly took an alcohol swab and wiped away the brown dirt, and he immediately felt better. I had an 80-year-old with dementia who, when was walking past my office, past my partner, Dr. Kellogg's office, seriously asked, could we stop and get some cereal? One of my favorite retirement cakes I ever saw from a patient. Goodbye tension, hello pension. And routinely I asked people how much alcohol they drink. The 63-year-old woman stated, not enough. I had a 81-year-old patient who had recent cardiac bypass surgery. Before the surgery, the patient asked the physician's assistant, since I'm paying a lot of money for this surgery, please do liposuction while you're there. Immediately after the surgery, the physician's assistant tells the patient, unfortunately, we could not do the liposuction, but your gender reassignment surgery was completely successful. I'd like to end on a quote that's one of my favorite quotes. Humanity has unquestionably one really effective weapon, laughter. Power, money, persuasion, supplication, persecution, these can lift at a colossal humbug, push it a little, weaken a little, century by century, but only laughter can blow it to rags and atoms at a blast. Against the assault of laughter, nothing can stand. Mark Twain. So I just want everyone to go out there. You know, these are tough times. It's hard to adjust. Try to see the bright in everything. Try to connect with people. Try to avoid watching the news all the time. And try to know that we'll get through this and things will be better on the other side. Thank you.
Thank you, Dr. Berger. You had a few comments throughout. Somebody asked if you could publish your Black book.
I actually have one of my patients is an editor, and I promised her at some point I would. What I read was heavily edited. Most, I would say at least half of the things in the book are probably not PG rated, so it would have to be in an appropriate forum. But at some point, I probably will.
And then somebody else asked, how is it that your patients are, except for me, are so funny?
I want to give credit. For example, humor is not an age-related thing. I have one of my patients who may or may not be listening, who's 102 years old, still has a great sense of humor, and is computer savvy enough to send me cartoons or jokes every week, which I enjoy. So, everyone can be funny. They're just funny in different ways. There's some people that are sarcastic. There's some people that have a very dry sense of humor. There's some people that like slapstick. No one can tell you what type of sense of humor you like, but just pick what you like and enjoy it.
All right, guys. I think that's great for a Friday afternoon before a 3-day weekend after a, 2-month weekend. So, thank you, Dr. Berger, for being here. Thank you for making us all laugh. Got some comments from patients that they really were laughing. So hopefully you enjoyed that, and I will see everybody next Wednesday. All right. Thank you, everyone. Take care, Dr. Berger.
Thank you, and thank you for listening. Bye-bye.